Hello and welcome to McLaren Port Huron Today's Health Program. I'm your host, Kelly DiNardo. Today we're going to explore care options for patients with complex health conditions. To begin, I'm speaking with Erin Sox, a case manager at McLaren Port Huron, about services that are available for patients and their families to help them as they are discharged home from the hospital. So Erin, thanks so much for joining us today.
Thank you. I'm happy to be here.
So tell me a little bit about case management. What is your role and how do you help patients within the hospital?
Care management is actually an important part of the healthcare team. Care managers help ensure that the patient's physical, emotional, and healthcare needs are met, while also ensuring that they transition to the appropriate level of care. They also implement interventions to help prevent unnecessary hospital readmissions. Consideration is given to both patients and families regarding their needs and their situations. Discharge planning is discussed with the patient by their physician, nurse, care manager, and sometimes a social worker.
Oh, wonderful. So really you kind of interview the patient and get down to really what they need so they can be successful at home or wherever they're transitioning.
Absolutely, yes.
Yeah. So can you tell us about some of the options that are available for post-hospital care?
Yes, there are many options available for patients depending on their level of function and needs. Those options include home care, subacute or short-term rehab, long-term care, palliative care, and hospice care. Those are the common reasons.
Awesome. And I know just for being a nurse for so long, healthcare has really changed. I mean, I remember way back when that patients would still be in the hospital after, like, say, a hip replacement. We'd be removing their staples. That's not the case anymore. Patients are really being, they're in and out a lot quicker. So I can imagine where case management's really that much more important.
Yes.
Yeah.
Yes.
So can you tell us about some of the examples, what kind of services that you help people secure?
Yes, in the home setting, maybe a patient who suffered a stroke might need additional assistance at home. For instance, they might need physical therapy due to paralysis or speech therapy due to speech issues. Another example could be a CHF or COPD patient who really need help managing their disease in the home to help prevent hospital readmissions. Some patients may need infusion services where they would receive antibiotics or nutrition through an IV line at home. There's also short-term rehab or skilled nursing, and that's for patients to help them regain their function and to help them get stronger so they can perform their daily activities at home. A common reason why a patient would need that, maybe after a hip or knee surgery, they might need to go to rehab for a short period of time. There's also long-term care. We work with families and helping them with patients who are no longer able to safely live at home. They can't manage their physical activities every day, so they might need some transitioning to a long-term care. There's palliative care, and that's for patients with life-limiting illnesses such as cancer, CHF, Alzheimer's, and that really focuses on symptom management and quality of life. Hospice care is for patients who are terminally ill when management of the symptoms is no longer curative, and typically those patients have a life expectancy of 6 months or less.
And so when you see patients, I mean, you probably see patients of all different ages. It isn't just the older people that might need help after home, when they're discharged home, right? I mean, if someone's diagnosed with a brand new diagnosis, new diabetic, for example, they really do need a lot of extra support to help them be successful while they're at home.
Yes, we help get them transitioned to home. We help ordering any supplies they might need, insulin. We help make sure that when they are transitioned to home that it's a smooth transition and that everything goes accordingly.
That's wonderful service. You had mentioned palliative care. I understand that there's a program now for palliative care. Can you tell us about that?
Yes, McLaren Health Management Group has a palliative care program, and it really focuses on symptom management, including pain, nausea, difficulty breathing, weight loss. And it's run by nurse practitioners who are trained in palliative care. It's a multidisciplinary program, so they work with patients and families and help provide support and education. and the medical care is coordinated to help from transition from hospital to home, and it's collaboration with the patient's other providers as well. And palliative care can be offered in most home settings, including adult foster care or assisted living.
That's wonderful. And it really is, palliative care isn't ending any kind of treatment. It's just really supplementing to, do a holistic approach. Is that?
Yes, it's to continue treatment while also making sure the patient is comfortable. That's the number one.
Wonderful.
Yes.
So you probably help a lot of people as they transition, and thank you for what you do for our patients. It's wonderful.
Thank you.
Service. And thanks so much for joining us today.
Thank you so much for having me.
And we do need to take a break, but stay with us. We'll continue the conversation when we return.